Have you ever been in clinic and had a patient leave the room and you can just sense that they're not too happy with the outcome? In MSK consultations, the ICE framework could be the key to unlocking better outcomes for your patients and for your own practice as well. Now, as I'm sure you're aware, ICE stands for Ideas, Concerns and Expectations, and it's a simple but powerful tool that we can use to better understand what our patients are thinking, what they're worried about, and what they're hoping for from coming in to see us. Now, this matters because a diagnosis is more than just what the patient reports, more than just their symptoms. It's about understanding the person behind those symptoms as well. So if we use ICE effectively, we can help to build rapport, we can avoid miscommunication, and we can deliver care that better aligns with the patient's needs and their expectations. So although these three questions can seem quite simple, it can be very easy to get wrong, and I've been there, and this is something that I've been working on myself over the years. But these three simple questions, if you get them right, can make a real difference. So the first up is the patient ideas. So I would start this one with something along the lines of, look, I'd be really interested to understand what you think could be going on here. And let's say we've got a lady coming in with shoulder pain, so Mrs. X coming in with shoulder pain, and we ask this question and she responds with something along the lines of, look, well, I think I've torn my rotator cuff. And it's really important that we expand on that a little bit. Okay, so why do you think this? Has she been on Google? Has she had a torn rotator cuff before? So she got lived experience. Has she got family and friends who've maybe sort of pitched in on that? They've had lived experiences. So we need to sort of expand on why they think this. And then I'd be moving on to the concerns, which is the next part of the ICE framework. So it's really important, just a quick note, to try and maintain the flow of the conversation. So I try and avoid staggering the questions throughout the subject. If I try and keep them all together and maintain the flow of the framework. So I would then go along the lines of, okay, so you think you've torn your rotator cuff, Mrs. X. It might sound like a bit of a daft question, this, but what would worry you about if you have torn your rotator cuff? And that's when they might go on to say, well, I'm worried I might need surgery, maybe I won't be able to play tennis again, I'm worried that it'll mean time off work, can't care for my husband, blah, blah, blah. So you want to explore a little bit about why they're concerned and why they're worried about that, okay? A little bonus tip for that section as well is to echo it back to them. So you might say, okay, Mrs. X, so you think that you might have torn your rotator cuff and you worry that that might mean you need surgery and time off work, is that right? So echoing it back just demonstrates that listening, demonstrates that empathy, and the patient will really notice that, even though it's just such a small part of the consultation. Okay, so then I would be moving on to the patient expectations. So with this in mind, what was you hoping for from me today in regards to today's consultation? And this is usually where they come out with, I need a scan, or I'll need a referral to your specialist, or they might just say simply, I just want you to do a thorough assessment of my shoulder, which is fair enough. But don't push back at this point. So for example, if someone is requesting a scan, let's say, and you think that's unreasonable or maybe not needed, don't be sort of trying to fight back. Don't be argumentative with the patient. Just say, okay, yep, let's take a look. It's my job to do a thorough assessment of you, and we'll come up with a shared plan together. Because if you start to push back, you're already creating friction, which goes against what we're trying to do here. Now, the beauty of ICE is that it's not just used in the subjective assessment, so we're not just using it for the sake of it, we're then going to sort of tie it into the management plan. So if we can integrate it effectively into the management plan, that's when you'll notice the real difference. So let's say you've assessed Mrs. X, you've done your thorough examination of the shoulder, you're not concerned about a rotator cuff tear, she might have symptoms of like a classic subacromial pain syndrome, whatever phrase you want to call it, and you can just explain to her something along the lines of, look, I know that you was worried about a torn rotator cuff and how that might impact on your life, maybe needing surgery. Well, the good news is from my assessment, everything that you've told me and everything that I've seen today, your symptoms present classic of subacromial pain syndrome, and then you'd go on to explain a bit about that condition and how that can get better. So it responds really well to rehab, etc., whatever your own terminology is. But you can see there that we've used ICE in the subjective to demonstrate our listening and our empathy, and then we've addressed it in the management plan as well. So we've sort of tied it all together. And if you get this right, it will be an absolute game changer for your practice. So next time you're in a consultation with a patient, just take those couple of minutes, less than 2 minutes, to explore their ideas, their concerns and expectations, and you will notice a big difference to your patient outcomes and care.